Let's talk about Government of Canada Drug and Health Product Register. This is a database for all of the Canadian products. Here we talk about the drugs and medical devices, of course, and natural products. We would like to know about what is registered in Canada. So you go to drugs and you search for the drugs. You can now see that for Effexor, for example, we do have several information. We can look into the summary reports, antidepressant, etc. And then it ends there. Okay, of course you have a lot to read, but it's not as sophisticated as the one that we had in drugs at FDA. This is my point. Now you may want, but what is interesting here is that for drugs at FDA, you had only drugs. Here, you can go on the top menu. You go to drugs, you have the drugs. You go to natural products, it's going to look into the natural health products database. You would like to know more about medical devices, it will bring you to medical devices database. If you would like to go to okay, I don't have cosmetics, it doesn't matter, I don't have it, but anyways, for medical devices, NHPs and drugs, we come of course to this database. I'm inviting you to please become familiar. Know that these databases exist so that we use these for building our regulatory strategy. Know that you can use the database because you are going to end up working on projects where we need information from existing trials. We may need to create a tabulated summary of again clinical trials, and where we go, we come to clinicaltrials.gov, or we come to the database of the Government of Canada for the again drugs and natural products and medical devices. Perfect. Now you understand very well where to go in order to look into the drugs, again, health and consumers products. Now, if you would like to know now about the clinical trials, okay, we have to go to this website, which is clinical-information.canada.ca. This is where you will be able to add your drug, and then it will give you some information, for example, clinical information. Let's see for Effexor again. You may not have too many, but maybe you may have some. We're just going to search to see what are the studies. Again, the way that it shows this way. Oh, okay, no problem. I think the previous, yes, this page was already showing that. Okay. So when we look into Effexor, we will be able to see the list of the information. Okay, it doesn't work. It doesn't matter. I will retry again. These things happen. Okay, so here I put Effexor, and then I'm going to click on search, and okay, it seems that it doesn't show any result. It was showing the results, but there's no problem. I just wanted to show you that this database is working, that it gives you underneath this table a tabulated summary of the studies as well. This is not again as elaborated as clinicaltrials.gov, but you may find studies that are only done in Canada, and you may not find any trace of those studies in the clinicaltrials.gov. It's rare, but if you would like to do a perfect job like always, we will need also to double check with the Health Canada database. You can also look into medical devices, where here, for example, I already add something about the ear device. You can see here as well in a tabulated summary, you can now look into different medical devices, when it's approved, what is the class, which manufacturing facility, and application number as well. And of course, if you would like to now click on different components, you are going to look into, again, information about that product. So I'm going to show you the information about the product. So this is the information. We have clinical studies, we have technical evaluation reports. For the clinical studies, as you see, for that device, Medtronic, that is the owner of that device, gave or submitted to Health Canada this information about the clinical studies. So again, it allows us to keep up to date our information on governmental databases. It also allows us, these registries, to look into what our competitors are doing. So overall, you will need to become familiar with those, with all of these different databases, and then to be able to use them for different projects that you are going to, of course, complete. Okay.